Hello everyone. Welcome to my YouTube channel. Before we start, don't forget to subscribe and click the bell button for more updates. Most people seldom notice that they are already experiencing depression. In this video, we will tackle causes and treatment for depression. Causes of depression. Two or more factors can have an effect simultaneously to cause depression. Depression can be an independent disease, or a part of other disease. Depression is also divided into different subtypes according to cause. 1. Reactive depression. This disease is simply a result from psychological stress, physical struggle or mental straining without proper rest or sleep over a long time period. The straining will simply wear out the nervous system or deplete the organism from nutrient necessary for the nervous system to work properly. 2. Endogenous depression. When there has not been any period of stress, straining or lack of rest that can explain the condition is often called endogenous depression. Inheritance is thought to be a part of the cause. 3. Depression by physical disease. Depression or depressive symptoms may be a symptom of physical disease. This is perhaps the most common cause of depression. Generally, there are three categories of diseases that give depression. Diseases often associated with depression are heart disease, Parkinson's disease, stroke, hypertension or Cushing's syndrome. Mononucleosis or flu may trigger depression that continues after the infection has gone. By lack of thyroid hormones, hypothyroidism, the metabolism in the whole body is slowed down, including the production of neurotransmitters in the brain. Therefore, depression is an important symptom of hypothyroidism. 4. Depressive symptoms as a consequence of unsound lifestyle. A general unsound lifestyle with too less exercise, too much of stimulants like alcohol, coffee or tea, too less of important nutrient and too much of sugar and fat may give depressive symptoms, as well as physical problems. 5. Postnatal depression. Women will often have a period of depression after pregnancy and birth of the baby. Pregnancy and birth is physically and mentally exhausting, and may drain the body for nutrient. This in turn can cause depressive symptoms. Depression can occur in cold and dark periods of the year and go away in warm and light periods. Light stimulates brain activity, and lack of light is a causative factor. Treatment of depression. Serious or prolonged depression is often treated with antidepressive medication. Medicines used against depression generally increase the level of neurotransmitters like serotonin in the central nervous system, or they mimic the neurotransmitters. The medications mostly used today increase the serotonin concentration by decreasing the removal of serotonin from the space around nerve cells. Examples of this medication type are fluoxetine, Prozac, fluvoxamine, Luvox, paroxetine, Paxil, escitalopram, Lexapro, Celexa, Centraline, Zoloft. By bipolar disorder in the manic phase, heavy tranquilizers, neuroleptica, are used to stop the manic symptoms. By bipolar disorder, lithium salts are sometimes used to stabilize the condition, and prevent new outbreak of depressive or manic phases. Psychotherapy is sometimes used by depression, usually in combination with medication. Sometimes serious depression is treated by applying electric shock through the head, electroconvulsive therapy. The shock induces epileptic eruption of nerve signals through the brain, and this gives cramps throughout the body. The cramps are alleviated or stopped by applying anesthesia before the electroshock. This form of treatment is controversial, since it can cause memory loss and is suspected of causing brain damage. The possibility of brain damage is however denied by most psychiatrists. By seasonal depression, light therapy may be useful. Adjustment of lifestyle should always be considered by depression or depressive symptoms. Lifestyle measures can sometimes be enough to cure depressive symptoms before a serious depression develop. Lifestyle adjustments can be: to slow down a stressful life with too much work or activities, enough rest and sleep, a good diet with enough of necessary nutrients, some physical exercise, meditation, supplement of vitamins, minerals, antioxidants, lecithin, amino acids and essential fatty acids. Stimulants like coffee or tea may help against depressive feelings in moderate amount. However, if you are a heavy user of these stimulants, you should cut down on your consumption. There exist nutritional products in the market to help against depressive symptoms. These contain ingredients that the brain uses as building blocks for neurotransmitters, for example amino acids and lecithin. They also often contain vitamins and minerals that the brain uses as tools to produce neurotransmitters, especially vitamin B6. Supplements may further contain herbal extracts that trigger higher brain activity, much like antidepressive medications, but may have fewer side effects. That's all for now, and thank you for watching. Health is wealth.